All right, so I am here with my sister, who happens to be an epidemiologist. Right?
That's cute.
And I do miss you. So my sister lives in Connecticut, and I'm a teacher in North Carolina. And during COVID, we haven't seen each other. So yes, I miss my sister, but she has fielded questions and phone calls since when?
Since the beginning.
Since the beginning of this. And I trust her, her thoughts and her deep knowledge of public health and the way that she can talk about the data and express it so that I can even understand it. So thank you for joining me on this sister chat that, will be public. So yeah, there's your warning, B.
Yeah, it's my pleasure. Thank you, Jazzy.
Oh wait, I didn't want that to happen. Next. All right, so, Veronica, I've been using the CDC websites and other data sources to try and figure out what is the inherent risk in school populations. And this statement is right there on the first page of their school decision-making, I guess, paper. And, it talks about how we all need to take actions to protect others because the whole community really matters in school transmissions. What are your thoughts about how the communities and schools are tied together?
Well, first of all, I appreciate that, schools play a much more important role than just educating our kids, right? I mean, a lot of parents who don't have other childcare options can't work, or they can't feed their kids without the presence of schools. So schools play a really important role in our communities and in the health of our communities. So I understand the desire and the push to want to keep them open. They keep kids out of trouble. There's a whole million reasons why schools are important. I think that, the kids at the end of the day are coming home to their households, and they're sharing whatever risk or infection that they're carrying with their families. So, the health of schools and the health of kids and faculty and staff in schools is just inextricably linked. So, I think the thing that's most interesting and troubling about coronavirus and COVID-19 is that, a lot of people are asymptomatic. And so that's probably one of the scariest features of this disease.
Absolutely. And, there are ways that we can track, the amount of infection in a community. And so the CDC has labeled 3 core indicators to look at when you're contemplating reopening a school. And, the first one, or the first 2 are community factors. And the last section are school-based factors, things that we can control within a school. So I've taken the data, figured out the data, I would say, for the first 2 community factors of my county. And then I kind of want to talk through the school-based factors and how I envision them being implemented correctly and consistently. Mm-hmm. But looking at this chart, I would, of course, want to be in a district in the green columns, right? Where there's lowest risk of transmission or lower risk of transmission. Mm-hmm. But we'll go step by step here. So community factor number 1 is the number of new cases per 100,000 people within the last 14 days. So how do you get this data? Of course, it's Johns Hopkins, right, Veronica?
Yeah, they're a leader in public health for sure.
Good old Johns Hopkins, which you may have attended.
I did, in fact, yes. You remember correctly.
And you may have earned a couple master's degrees.
I did.
So I'm going to share their data source is beautiful, and it goes by county. You can search by state or by county anywhere in the US. And they have a graph of the number of cases in the last 14 days. So when you hover over you know, how many days and how many positive cases were in your county, you can kind of see the average and you can see if it's raising or if it's leveling out. And what I did was I put it into a spreadsheet. And for the last 14 days of data that we have, because today is October 18th, there are 1,532 cases in my county. It's kind of significant. Our total population is over 1 million. They say to calculate it by adding the number of new cases and then dividing by the population, which I did here, and then multiplying that by 100,000. So our number for our 14-day core indicator number 1 is 146.38. That puts us in the higher risk of transmission in schools. I'm not sure how that's weighted in terms of looking at the 3 indicators, right? So, you know, of course I thought, well, that's terrible. That's a higher risk of transmission in schools. Let's look at the other core indicator that's a community factor. So the second core indicator factor is about the percentage of RT-PCR tests that are positive during the last 14 days. I don't know what RT-PCR is. Are you aware of what that is?
Yeah, so a PCR is a polymerase chain reaction. It's a test for COVID that you do that identifies fragments of RNA from the virus in a sample. So in a nasal swab or in a saliva sample for COVID.
Okay.
It's the gold standard. It's the most effective test we have to diagnose COVID.
Okay. Okay. So I pulled this chart this morning from our North Carolina Department of Health and Human Service data dashboard. And Wake County is this beautiful county right here in the center. And if you click on our graph, you're going to see that it's, you know, 4% for Wake County positive tests. You can also see on that graph, it's not interactive, unfortunately, but you can tell that we have been as high as 8% this week. So are we green? Are we yellow? I would like to think that the 4% puts us in a lower risk of transmission in schools.
Well, okay, so, you know, one thing is new cases and the other thing is positive tests, right? So they should be pretty similar, but, you know, it depends on the data sources. So the percentage of tests that are positive, that's your positivity rate. That's what I think, you know, a lot of places use to track overall transmission, because the number of new cases by itself doesn't tell you, you know, those are only people that got tested. So it's not really the most accurate number.
Okay.
I mean, neither is really, I mean, so anybody that has any symptoms in the community is going to, you know, and gets tested for COVID will add to the denominator in the percentage of tests that are positive in the last 14 days. It's better than looking at the number of new cases, maybe. They're just different indicators. But I mean, what you would really want to do is test everybody in the community, and then you could actually get a community prevalence, right, of tests. But
absolutely,
that's the reason why we have different indicators, so that we can kind of put all the data together and see what's going on. So, you know, yeah, I think when you have, you know, a positivity rate for the second indicator there that's over 3%, then you start to worry that you're going to have more, you know, easier transmission of COVID in the community.
Okay, and when you say easier transmission, you're talking about kind of seeping into that yellow column.
Yeah, I think, you know, you're above 3%, you're looking at the risk starting to go up, right?
Right.
So you know, I can't tell you which one you're at, or, you know, if you're in the green, it means nobody's going to get sick. No, it could change, you know, within a couple days. If, you know, there's one case in one school and everybody in that school gets tested and it picks up asymptomatic cases plus symptomatic cases, you know, so these things are kind of fluid. It's not a perfect science.
And as I'm aware, we don't have the capacity in North Carolina to test everyone in the school like that to try and find asymptomatic cases.
Right. And I think most places don't have that. I know here in Connecticut, when the transmission rate is above, or the positivity rate, excuse me, is above 3%, then our superintendent starts to get a little nervous about reopening the schools for full face-to-face for everyone. So that's the current discussion here.
And you said it's 3% is where people start to look at the data more carefully.
Yeah, then you start to think, I mean, I think it's the same at Yale. They're looking at that for their student population. When you get above 3%, then you're looking at more moderate risk. And then you really need to close, gyms and, anywhere where people are inside, not covered, their faces aren't covered by masks. They're in small areas with poor ventilation, and there's lots of people. So, yeah, that's the recommendation currently.
Yeah, so don't go to the bar and sing karaoke.
Mm-hmm.
So the third indicator is the school mitigation assessment. And, that's a hard thing to gauge because we have yet to open the building to students. But looking at the 5 strategies and thinking through how that is likely to be consistent or inconsistent, I just want to talk through those strategies with you one by one. Because children, you have a couple. I know children, I have 20 years in schools, public schools. So, we all have our ideas of what that might look like. So if we implement all 5 strategies correctly and consistently, which is the goal, then we have a lowest risk of transmission in schools. But if all 5 are implemented, but it's inconsistent in a school building or in a school district, then we're going into that lower risk. But what's shocking is that it becomes a moderate risk if just one of those strategies isn't implemented correctly and consistently.
Yeah, I think it's hard, I think, because kids don't want to keep masks on. So I think it's age dependent. So, maybe for older children, that's not as difficult. But yeah, I think that's probably one of the first and most important strategies, right?
Absolutely. And in my district, they've released videos on how to wear the mask. We've instructed parents to start practicing, let your child wear a mask for a few hours at a time. But when kids go back on Monday, we're not sure how many children will have had an experience with a mask on their face at all. They've been safely at home. Some have been in daycare. And I'm sure daycare workers would tell you that it was inconsistent. I think it's possibly inconsistent that pre-K through 5th grade will be able to use their mask correctly. Another thing that worries me is, the eating, right? Because I have not eaten in a restaurant since March. And when children are socially distant, because we'll have social distance meals together, if they're socially distanced in a room with great ventilation and they have to take their masks off to eat, what are the risks of that kind of scenario?
I mean, to me, that's the scariest thing, right? I also have not eaten inside a restaurant for exactly that reason. I think a lot of people unrelated from different households in a small space that's poorly ventilated or even ventilated. I'm just not interested in that. I think we know that COVID is airborne. It's going to stick around in the air for a long time. And, when you take those masks off in a whole cafeteria, imagining, cafeterias in schools, they're sharing all their germs. So you could have masks on all day, but if they're coming together and taking them off for 15, 20 minutes a day, then it kind of cancels all that work of trying to cover people all day. It cancels it out. So I think that, probably better options would be eating outside, still social distancing, because we know there have been cases at parties where adults have spread and to kids as well. They have spread COVID. Even just being in close proximity and being outside. So you can't get much better ventilation than being outside. So yeah, I think that's really concerning.
So, I put my mask icon on that lower risk because I do believe that teachers can do their best to socially distance and to make sure that kids are masking when it's possible. But that inconsistency with the lunch and the breakfast times, and like you said, the aerosolized nature of it within a space that they share makes it dangerous. Do you think because they're not using a mask when they eat, can it even be seen as a correct implementation?
You have to take off your mask to eat.
Right.
And you have to let kids eat. So,
yes.
I think we all do the best we can in these situations. And, ideally, I think it would happen outside or in a really well ventilated area if you minimize the amount of time that kids have to eat. But I think already in most schools, kids have to scarf down their food so quickly in schools nowadays. It's difficult to say. I think it's, you have to really, I think for me, the most difficult part of this pandemic is trying to weigh the risk with the benefit, right? So the benefit of kids being in school and getting to see each other and interact socially, there's a big benefit to that. But, there is a risk of transmission no matter what you do as soon as you leave your house or anyone comes into your house. So I think what we try to do in public health is kind of mitigate that risk and try to practice kind of harm reduction. So keep the risk as low as we can, but still allow certain activities to happen.
Absolutely. All right, well, I'm going to move on to the second one because I feel now I may have been too conservative with my placement of the mask. So the second strategy is social distance to the largest extent possible. When I think about social distancing, you think of the wait 6 feet apart, right? And in schools, teachers can set their desks 6 feet apart or more. In most classrooms, that will work. However, we've got buses. Kids take transportation to school. And on those buses, because of the numbers of certain routes, we will not likely be able to keep kids masked and 6 feet apart on our school buses. So to start out your morning, you may be in a risky situation riding that bus with other students. Our bus drivers will have masks and face shields, but they're on that bus longer than anyone else. And I do believe that it will likely not have people 6 feet apart, and that the ability to monitor that situation will not be consistent.
Yep, I'd have to agree with you there. I think, you can keep the windows open and all you can do is just try to, the normal things you would do on a bus, like not letting kids raise their voice or yell or stand up. That will help, reduce the spread. If kids are infected, keeping masks on as much as possible. And I think kids can be compliant. I think it depends on the age, but I think they get it. If they've left their house at all, they've probably had to wear a mask going out. And, I see kids being pretty compliant. I think it's more adults that are the problem. Adults are the ones I see that wear it below their nose and just drive me nuts,
Right. But I think some of that is that kids are still, like my children, they might go out once a week on a shopping trip with me for a half an hour, whereas
right.
I'm out more frequently. So it might just be we're not seeing the kids as frequently out and about. They've got their video games, you know.
For sure, for sure. No, I agree with that. And I know our schools. Both my kids are in fully remote schools. They're not in school this year, but I know that at the schools here, they've also instituted mask breaks where they let the kids go outside and stay socially distanced, but physical distanced, but they're allowed to take off their masks and kind of take a break. So
Absolutely. And
I
yeah,
don't
that is
know.
part of our plan. Part of our plan is to have the mask breaks. Absolutely.
Mm-hmm.
So next strategy, the dab. Kindergarten teachers everywhere will tell you they teach their kids to dab when they cough or sneeze into their elbow, right? That's our respiratory etiquette. However, if you're wearing a mask and you dab sneeze, what do you do with that mask?
What does dab mean?
Come on.
Wait, do you mean the way the kids mean dabbing?
Yes, I mean the
Okay. All right.
dabbing.
I thought it was an acronym for something else. Okay. Yeah, I know what dab is. Okay. Well, yeah, if a mask gets wet, then it's not going to effectively prevent the spread of air and germs, right, coming in and out. So if somebody sneezes into their mask, then probably they should change their mask.
Okay, so let's say teachers have taught students, if their mask gets wet in a dab sneeze, reach into your desk, grab another mask. Oh no, sorry, wash your hands, right? Blow your nose, wash your hands, reach into your desk, put another mask on, a clean mask on. And of course, forever, teachers have taught hand hygiene, how to wash hands. We have songs and rhymes dedicated to it. I think we can do that. So we know soap kills corona. I put that in the lowest risk category because I do believe that teachers and students can work together to make sure that they take care of themselves and their respiratory etiquette and hand hygiene. Have faith that can be correct and consistent. So then we get to cleaning and disinfecting. We have cleaners and disinfectors and materials promised to each teacher in the schools. And I know that we have sanitizing stations in every classroom. We are going to have, I guess, protocols for how often we clean and which surfaces and who does that cleaning. But it's tricky when I think about all of the surfaces that we touch throughout the school day and the ability, let's say, of one janitor to clean 3, large school-like bathrooms 4 times a day.
Yeah, that definitely seems a little impossible. I think cleaning surfaces, deep cleans once a day is probably great. And then, cleaning in the middle of the day as much as you can around kids, minimizing their exposure to chemicals. But I think that more important than cleaning is probably ventilation. So, I think what we've seen with coronavirus is that it doesn't, like, surfaces are not as big of a route of transmission as we previously thought and expected. So I would be more concerned about airflow and ventilation. I think good cleaning is, of course, important and, should be practiced according to whatever the guidelines are, at least once a day and probably other, routine. But I think that ventilation is really, really important.
Yeah, and that's interesting because ventilation is something not addressed, on the CDC chart of mitigation strategies.
Yeah, it's expensive, like I know our schools here came up with the money in my really well-funded small town in Connecticut, and they upgraded all their HVAC and ventilation systems in the schools before they allowed kids to go back into school. And when the school year started, they either gave people an option of all remote, fully remote, or a hybrid where they basically split the kids up into 2 cohorts. And one week you go in person and the other week you go online. and then they switch. But I know that, in preparation for that, they were able to upgrade their ventilation systems.
And I will say that in our district, we have, over 150 schools, and all those buildings are different in, their age and their ventilation systems.
Mm-hmm.
I know that the district's been working hard to change out filters, at least. So they've upgraded the filters within their air systems. Do you think that that is enough? If they add a HEPA-based filter within the fan or the system that they have in the classrooms?
Well, I think with these things, there's really no absolutes, right? You try to reduce the risk wherever you can using various strategies. I think it'd be really difficult to say, and I don't think there's ever been any studies done. We're so early in the pandemic, really, when we think about a brand new virus and for the world and what we know about it, it's really very little. So I think we do the best we can to mitigate and reduce the risk. So I think having filters is a great thing. It's a good place to start. Hard to say what's enough or what a standard would be, because I don't think we've really defined that yet.
Right. Okay. So the last one is contact tracing. I know that our schools will collaborate with the health department. All of the school staff on our COVID care teams are trained and are willing to take this very seriously and communicate immediately with the health department if we have a suspected case or a case in our school building. What worries me is that our North Carolina Department of Health and Human Service secretary last week stated that in our state in North Carolina, compliance is about 50% when it comes to contact tracing. She explained that about half of the people who have tested positive will not answer a phone call from a contact tracer. And of those people who do answer, not all of them are forthright and transparent about where they've been. So yes, the school will collaborate with the health department, but when our community itself isn't at a high level of collaboration with public health department, it worries me.
Yeah, it's a really difficult thing because, like you said, contact tracing is only as good as people who will participate. And without strong public health infrastructure and messaging, that's really hard. And, contact tracing is one of the most important tools we have in stopping the spread of COVID in the community. And, yeah, it's really tough. I think that public health departments do a really good job and they try really hard, but if you can't get lay members and community members to understand the importance of it and keeping everyone safe, it's hard. And I think, a lot of people really depend on schools so that they can work and they can pay their rent and buy their food and, take care of their kids. So if you I'm sure people think that if you tell too much about who you've been in contact with, then it'll negatively affect somebody in their household or in their community. And, staying home for another 2 weeks to wait and see if you've developed symptoms and quarantining if you've been in contact with somebody who's positive. Not all families can do that equally. There are huge disparities in this country in who's an essential worker and who can take time off work and get paid while they're doing that. And the government is not supporting families with, rent assistance or unemployment assistance after a couple more months. And, these are larger issues than just, at the state or county level. It's really a lack of federal leadership, both in terms of public health messaging and in economic support, because you can't have health and economic policy being separate. They're so intertwined.
Right. And so the people who are refusing to be completely forthright may be doing that so that they can pay their bills.
That's right. Yeah. I think you can't put too much blame on the individuals in this case. I think that if we had a society and policy that supported people better and worked on evidence like other developed countries did, we could have a much different outcome. It doesn't have to be like this in this country, but unfortunately, it's such a lack of leadership that that's where we are.
Hashtag vote.
That's right. That's right.
So, just to sum it up, here's where we stand as a county, looking at the core indicators from that CDC chart. So what is our level of risk for my county? When I look at this, it's like, okay, we're kind of all over the place, but most likely there's a moderate risk of transmission in our schools. When we open on Monday, there is a risk.
Yep, for sure. I would agree with you. Probably moderate is a good, average there of where you are. And I think that, for me, I understand and recognize that public health planning in schools is not what you all are educated and set out to do. It's a tough task, and making these risk benefit decisions is really hard for your leaders in education. I think that it would be important to define how many cases are you willing to tolerate within schools of children and teachers and staff, and potentially how many deaths are you willing to tolerate before you decide to close schools? Where does that risk benefit equation kind of stand? I think that's the really difficult and unenviable task.
So do you feel like, that we had a county, let me just say it this way. We had a county, Stanley County in North Carolina, lose a teacher, and Julie was a third grade teacher, and she died of COVID. Young teacher. So with that one death and a few cases in that third grade at her school, they closed the county and they decided to go all remote. And that's a small county where it took one. Do you feel like leaders actually have a number that they'll tolerate? Or is it more of a political thing? What kind of media attention does it get before they feel the pressure, or the community understanding of it is that it's dangerous? It's really uncomfortable.
Yeah, it's hard. I don't think that anyone wants, political, educational, or public health in any of the communities want people to die or want to tolerate any number of people dying, right? 0 is the is the number we all are going for there. So I think, yeah, it does depend on, what happens in the community.
Well, I'm sure we'll have more conversations about this as this week goes on, and our schools practice procedures and how to keep transmission low. I want to thank you, V, for spending time with me this Sunday morning.
Oh, you're welcome. It's so good to talk to you. And, I tell all my kids' teachers, the work you do is so amazing in the community. And, I really hope that one day teachers are recognized for all their knowledge and passion and skill and caring with which they educate our children, because you guys are amazing.
Aw, thanks, V.
Yeah. All right.
Thanks. I'm gonna get us off the record now.
All right. Thank you.
Thank you.